Hello, welcome to NAFDAC and Your Health. On this program, we bring you the activities of NAFDAC in fulfilling her mandate of safeguarding the health of the nation. I am Opejemi Orimolade. The main feature on today's episode of NAFDAC and Your Health is the recently held inauguration of the federal and the state task forces dedicated to combating the proliferation of counterfeit and substandard medicines and unsafe food products. The episode will also feature updates on NAFDAC's regulatory activities. NAFDAC's fight against counterfeit and substandard drugs, unsafe and unwholesome food products, unapproved packaged water, as well as chemicals and drugs is an unrelenting one. This is because the agency is unwavering in fulfilling its mandate of safeguarding the health of the Nigerian citizens. This drive to curb the menace of substandard drugs and unwholesome food products was further boosted recently with the inauguration of the federal and state task forces dedicated to combating counterfeit and substandard drugs, unsafe and unwholesome foods, as well as unapproved packaged water. The members of the task force were inaugurated by the Honorable Minister of Health and Social Welfare, Professor Pate. In his keynote address at the inauguration of the task force, the Honorable Minister of Social Welfare, Professor Pate, described the launch of the federal and state task forces dedicated to combating substandard medicine and unwholesome food products across the country as part of the ongoing efforts to protect the health of the Nigerian people. Acknowledging the contribution of NAFDAC under Professor Adeyeye in the achievement of President Bola Ahmed Tinubu's health security agenda.
We gather here to officially launch the task force on counterfeit and fake drugs and unwholesome processed foods, which is a crucial step in our collective effort to confront a pervasive and growing threat. This is very much in line with the renewed hope aspirations that our President Bola Ahmed Tinubu GCFR laid out, that Nigeria can be a peaceful, prosperous and people-oriented country. For that to be in health, we needed to do a few things. One was to strengthen the governance of the sector. What do we mean by the governance? Meaning that we have effective, efficient regulators. NAFDAC is one of those regulators that we're working with the DG, all of you, and the board of NAFDAC to strengthen the regulatory capacity of NAFDAC. And the fact that this task force is being inaugurated, launched, alongside other government agencies relevant to this effort, says to the importance of a strong regulator that ensures that we protect the safety of our people. The second pillar of the President's agenda in health was to ensure that we do what is necessary to improve the population health outcomes, that the health outcomes are better. We know non-communicable diseases, hypertension, diabetes, cancers, asthma, various skin conditions are rising in many parts of our country. And this is not only in Nigeria, but across our continent, but also, I would say, across the globe. But how does it relate to NAFDAC? Because the counterfeit medicines affect somebody who may have hypertension, diabetes, and taking the wrong drugs. They will take the drugs, but the drugs won't work. And through unwholesome processed foods, the factors that accelerate cardiovascular diseases, peripheral vascular diseases, strokes, cancers can get into our food chain. And hence, you see the connection between the outcomes and what NAFDAC is doing. When we are trying to unlock the healthcare value chain, which is the third pillar of the President's agenda, to do that, we need a strong regulator, because a strong regulator will help the industry get the muscle memory to be able to, the strength to be able to produce good quality products. If you don't have a regulator and you produce something that is good quality, someone else can produce a substandard and compete for the same market and undermine you. And we don't want our country to be known for producing products that are not quality that is necessary. So you see the connection between NAFDAC and the third pillar. And the fourth pillar is the health security agenda, which is our ability to produce what we need to protect our borders and protect our health and our ability to stockpile necessary products is also linked to that. So you can see how NAFDAC is a key pillar, key anchor in terms of the various efforts that we are undertaking across the health sector. So your achievement of ML3, maintaining that level, I think is a good step.
The Minister of Health also charged other relevant agencies to gear more efforts towards safeguarding public health.
The law that the DG quoted provided us with a powerful tool to confront these dangers. But laws alone are not enough. They require our commitment, our collaboration, the collaboration of all the actors that are here. I'm very glad to see the commitment of the customs, the army, the police, and other regulatory and security agencies, and the Office of National Security Advisor, who have been really working hand in hand with the NDLA and others to ensure we work and regulate, including the private sector actors themselves, the industry players, and also the people. Because I think without the support of Nigerian citizens understanding that it's in our collective self-interest that NAFDAC succeeds. So today I call on everyone present to recognize that this is a shared responsibility for all of us. The success of this task force at the federal level as well as state levels when the governors inaugurate them depends on our ability to work together swiftly, decisively, and transparently. We must enhance surveillance. We must enforce the regulations that are there strictly and educate the public to recognize and reject counterfeit and unwholesome products. Let me be clear. The fight against counterfeit drugs and unsafe food is urgent. Every delay that we make costs lives and livelihoods. And every partnership that we forge, every effort that we can make brings us closer to a safer and healthier nation.
The minister then went ahead to inaugurate the members of the federal and state task forces. Dr. Martins Iluyomade, the NAFDAC's Director of Investigation and Enforcement, was sworn in as the chairman, while members were drawn from both NAFDAC and PCN. The Minister of Health had earlier congratulated and commended NAFDAC for sustaining the MLE status as announced by the World Health Organization recently.
I would like to congratulate the Director General and the entire staff of NAFDAC for this amazing accomplishment of maintaining the maturity level 3 designation of NAFDAC, of the Nigerian regulator. This is very timely. I know it's not easy when you're top of the pile to keep yourself up. But by this designation, NAFDAC is among the top national drug regulatory authorities in the African continent. We're very proud of you. Stand up and get the acclaim. I think we will clap for you. Maintaining that level, I think, is a good step. We encourage you to continue with the ML4, that is our mandate for you, so that you get to the stringent regulatory, the WLA sort of state.
The program continues after this short break.
Beware. Fake or damaged drugs have put many people in serious health harms and have killed many others. But you can protect yourself by seeking professional healthcare advice when you feel unwell. Buy drugs from only licensed pharmaceutical outlets and make sure you check the packaging for poor condition, spelling errors, and unclear labelings. Also, check NAFDAC registration number, batch number, the expiry date, manufacture date, and manufacturer's address before paying, and always collect a receipt. If you suspect a drug to be fake or damaged, report immediately to NAFDAC on 0800-162-3322 or send an email to sf.alert@nafdac.gov.ng. Protect yourself and your loved ones. This message is brought to you by NAFDAC with support from WHO.
It's good to know that you're still there. You're still watching NAFDAC and your health. Earlier in her opening address, the NAFDAC Director General, Professor Mojisola Adeyeye, stressed the need for the task force to be in place.
Today, we confront an insidious threat that jeopardizes the health of our citizens, the integrity of our healthcare system, and the trust that Nigerians place in the products they consume daily. The proliferation of counterfeit and substandard medicines, as well as unsafe processed foods, is a challenge that demands our immediate and unwavering attention. The establishment of this task force, empowered by the provisions of CAP C34 bill, is a testament to our collective resolve. It is a recognition that the fight against these illicit products requires a coordinated, multi-sectoral approach, one that is swift, decisive, and relentless.
The NAFDAC DG highlighted previous efforts made by NAFDAC to show the commitment of NAFDAC to fighting the cause, emphasizing the agency's commitment to the cause and readiness to collaborate with relevant agencies.
In December 2023 and 2024, in this new administration, NAFDAC conducted enforcement operations at Eziokwu markets in Aba with the support of the Nigerian police, the DSS, Nigerian Army, and this resulted in seizures of billions of naira of fake fruit juices, drinks, milk, and wines. Between February and March 2025, the agency conducted, first time in history, coordinated operations at major drug markets, Idumota, Onitsha, and Aba Ariara markets. The National Security Advisor provided 1,350 forces for these operations, and this resulted in the evacuation and destruction of over 137 40-foot truckloads of counterfeit and substandard products, valued at over 1 trillion naira. This massive seizure not only removed dangerous food and medical products from circulation, but also sent a strong message that Nigeria is serious and has a renewed hope about protecting its citizens under President Bola Ahmed Tinubu GCFR. These operations led to the arrest of numerous illegal traders and the seizure of a wide range of fake medicines, unregistered drugs, and unwholesome processed foods. The scale of these seizures underscores the gravity of the threat and our unwavering commitment to combat it. These efforts exemplify that the fight against counterfeit products in Nigeria is urgent and ongoing. Lives are at stake every day. Women, children's lives are at stake almost every minute. And delays in action only deepen the risks faced by our people. We must act now with purpose, resolve, and unity. NAFDAC stands ready to lead this charge rather. Our mandate is clear: to strengthen enforcement, enhance surveillance, and work collaboratively with industry and stakeholders, the law enforcement agencies, and the public in order to eradicate these illicit products from our markets. However, success depends on collaboration. It is only through these collective efforts of all stakeholders, government, industry, consumers, and partners, that we can effectively address this menace. I call upon every partner to bring their expertise, resources, and unwavering commitment to this vital mission. In the coming weeks and months, we will intensify our efforts, roll out public awareness campaigns, and leverage innovation and technology to stay ahead of those who seek to undermine our health and safety standards. Let this launch serve as a rallying point, a reminder that the fight against counterfeit and fake products is a shared responsibility and an urgent priority. Together, we will protect our citizens, uphold our national health standards, and restore trust in the integrity of our medicines and foods. I thank the coordinating Honorable Minister of Health, our partners, and our stakeholders for their dedication to this cause. I'm confident that with our combined resolve, we will turn the tide against this menace.
The PCN Registrar, Pharmacist Babashe Ahmed, who joined the event virtually, also spoke on the appropriateness of the inauguration.
And I want to congratulate the DG and all of us for the reactivation of the federal task force and state task forces. Indeed, these task forces, as appropriately highlighted by the DG and the Honorable Minister, they are statutorily established, meaning that they are properly guided by CAPCIT, by the content or the provisions of CAPCIT 34 LFN 2004. And I want to strongly appeal to all of us to follow through the provisions as clearly enshrined in that particular act. Today we have a lot of hawkers who are going around with medicines everywhere. I think though we already have a well laid out structure to address the issue of the open drug market, the hawkers are a great menace in the system. And I want to urge all of us to take this assignment very seriously, and I wish us well.
Also speaking after the inauguration, the chairman of the Federal and Zonal Task Forces, Dr. Martins Iluyomade, expressed his appreciation to all stakeholders for their support.
I want to thank the Honorable Minister, who is irrevocably committed to doing what the President wants done. The most powerful enforcer on earth. My DG, the DG of NAFDAC, her support has been seriously been the motivation for which we run. Thank you, man. It's very rare to have this level of commitment from anybody. I also want to thank the DG of PCN, the registrar. I know some of those meetings. The DG will call me. We have a meeting now with the registrar, sometimes at all hours. And he will, every time he will oblige. Every time. And with, you can hear what he said here about commitment by all the state offices, from PCN to this task. This is a rare privilege to see people who are committed. And I want to say all these people have tried. They are right now what I call an epitome of support for the Nigerian project, because the issue of fake drugs goes beyond even the implication of health issues. It's also a security matter. You can wipe out a nation without carrying a gun. You can wipe out a nation without carrying a gun. All you just need to do, poison what they eat, poison what they take. It's simple as ABC. And that's why the NSC, also I want to thank the NSC. We should have started from there. Because the level of support that he has given to this project is so enormous, and it's because we have somebody there who understands the nexus between health and security. I want to thank the NSA. I remember during the ODM operation, the office was fully committed. Everything we need, just have it. Everything, just have it. It is supported to the last. Now to everybody seated here, I want to say thank you. Now you are here is a testament to the fact that you are committed to this dream of eradicating to the barest minimum fake and substandard medicines from our country. The regulatory officers from different ministries that are here, the enforcement officers from police to military to customs, we want to say thank you.
And now, moving on to NAFDAC news updates. The National Agency for Food and Drug Administration and Control, NAFDAC, has warned Nigerians about counterfeit 12-gram cowbell milk currently in circulation. In a statement issued recently, NAFDAC clarified that Promasido Nigeria Limited, the official marketing authorization holder of cowbell, ceased production of the milk variant in September 2023, replacing it with cowbell creamy goodness. The agency said the counterfeit product mimics the discontinued milk packaging but is neither manufactured nor distributed by Promasido, adding that the fake sachets unlawfully bear the cowbell brand name, NAFDAC registration number and packaging design. NAFDAC warns that consuming counterfeit milk poses serious health risk, including exposure to toxic chemicals, unapproved additives and diluted ingredients. The agency said such consumption can lead to foodborne illnesses, allergic reactions, organ damage, and, in extreme cases, death, adding that infants, children, pregnant women, and the elderly are especially vulnerable to the dangers of the fake products. The counterfeit products currently in circulation are imitations of the discontinued milk packaging and are not manufactured or distributed by Promasido. NAFDAC therefore warns consumers of cowbell milk to beware and be vigilant when purchasing the product. That was NAFDAC Update. You have been updated.
We have come to the end of our package on this episode of the program. Do join us again next week for another enlightening episode of the program. We're always ready to receive your comments, complaints, reports, and observations on fake, expired, or adulterated food products, drugs, and other NAFDAC regulated products.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct,